In late December 2015, the Central Health Region of the Ministry of Health released a report to its stakeholders and partner agencies on information collected from the epidemiological unit on some of the major health issues in the Belize district. The report is only for the first 10 months of 2015, but the partial data shows that infant mortality was up by 61%, from 16 to 29 deaths due to severe prematurity and congenital malformations.
The infant mortality basically is showing that the infant mortality rate has increased in the first 10 months of the year, which means that in the year 2014, in October, we had 19 infant deaths, and it increased to 29 infant deaths. And when this occurs, it represents a public health issue for us, because the trend is, instead of increasing, we would like rates to decrease. So when this occurs, it's alarm to say that something might be wrong, either in the community or at health facilities. And we're more concerned with primary health care. So basically, it's what is occurring at the primary health care level that we can do then to curb this rate.
Sir, did the statistics show any as to like causes of the mortality?
Yes. There are two major causes that I would like to expound on. One, severe prematurity, and two, congenital malformations. And we saw that the highest numbers were within these two categories. If I'm not mistaken, it was like 14 and 6, right? So it's about 20 out of the 29.
But according to Central Health Regional Manager Dr. Javier Zuniga, these are two of the more preventable causes of infant death. Through its research committee, the Central Health Region also analyzed data in reference to obesity, and the results were shocking because obesity is considered the mother of health risk factors.
If we would pass on the roadside or street side, out of 10 people, we'd probably see 6 or 7 who are either overweight or obese. So this also is what we call obesity is the mother of health risk factors, and it forms a part of what we call the deadly quartet, which includes hyperlipidemia, which means high fats in the blood, diabetes, and hypertension. So these 4 risk factors lead then to complications, or what we call a metabolic syndrome, that then leads to the other non-communicable diseases. In the case of obesity, I could say that females are more obese than males. Approximately 64% of the population that we targeted, so which means 6 out of 10 are either obese or overweight. Overweight and obesity type 1 are the two highest. They take up most of the statistics, right?
Dr. Zuniga says the objective is to identify problems and to implement interventions that are cost-effective to lower the rates of communicable and non-communicable diseases.
The idea is to, 1, identify the problem, 2, make a plan for interventions. They have to be cost-effective as well. And then, of course, implement that in the community, and then do an evaluation after a couple years, to see if the intervention was effective. And that's the plan that we have. So, but first we need to start from the groundwork, right? And then work our way to curb that prevalence as well.
Wayne Moody for News 5.